scribing?
Medical scribing is actually a very vast industry. I mean, scribing, the word itself means documentation. So if you ask me to give a brief idea about medical scribing, it may take at least 5 minutes. But if you give me time, I can talk about this for maybe months together. So even if you look into the olden ages of this Ayurveda doctors, I'm talking about BCs. When the Ayurveda doctors used to um, prepare medicine or do whatever, they had this disciples who used to document everything. They used to document in maybe leaves or bonds or animal skin or anything. So it started from that period of time. Now it has evolved so much. Nowadays we use high-end technologies like Google Glass. So if you're talking about medical scribe specialist, they use technologies like Google Glass technology, and then we have other medical scribing jobs like, let's say, clinical note reviewer, medical note reviewer. So it's just not that easy to explain in one word, but I'll just try to make it as brief and as easy as possible. So let's say it starts off with a doctor-patient encounter where the medical scribe, I'm not talking about medical scribe specialist alone, okay? The first step of documentation when it comes to medical scribing starts about a doctor and patient talking to each other. So this medical scribe is supposed to record the whole conversation and then convert it into a medical legal document, which later on needs to be processed for various reasons. It can be for legal issues, it can be for insurance purpose. So when it comes to new generation jobs, we do train people to be any form of medical scribes, but we take specific pride in being the best in the world when it comes to training medical scribe specialist. And when I'm saying best in the world, I'm not just saying it. It is, accepted by US doctors. That is what I take pride in. Our company takes pride in providing the best medical scribe specialist in the world as per US physicians.
Tell me about CPMS.
Okay, so easy, very short question. It's gonna be a very long answer. I'll try to make it as brief as possible.
Okay.
Full form certificate program medical scribing, not good enough. I have to explain more what it is. See, as I told, there are a lot of varied and varied type of medical scribing jobs, and topmost what we consider is like medical scribe specialist. CPMS was a program that took us years to be precise, starting from 2014 March and ending by 2016 November. So how many months? Just tell me. 2014 March, 2015 March, 1 year. 2015 March to
16 March.
2 years. 2016 November. So it's like close to 3 years of hard work. Not just hard work, actually it's not one person, okay? I'm talking about around 72 teaching faculties, 300 plus trainees, and we trained all of them, and slowly it took so much time and effort. Definitely I don't have to talk about the finances here, to develop this training program, to make it the perfect training program. That is why I proudly said earlier that we are the first and we are the best when it comes to training medical scribe specialists. Now there are 3 levels for this program. So level 1 is of 616 hours. In that period, we train people to be employable in any form of medical scribing job, starting from jobs with a starting salary of, like, let's say around 18,000 rupees per month, and then it goes to level 2 training. So level 1 is 616 hours, level 2 takes around 4 months, and during this period, they become employable into various kind of medical scribing jobs where the starting salary would be around 25 to 30,000 rupees per month. And I hope you understand that even during this pandemic time, we don't have any lack of job opportunities. all our students get placed even today. All our students who already got placed are still working today, and they all get their salaries. They are all working because we are part of healthcare industry. I hope you know that. Healthcare, you know, you are into banking industry
It's
and
a recession-proof
insurance.
industry.
It's a recession-proof industry. So they still continue their jobs, and we are still, trying to get more and more people. So when it comes to level 2, as I said, 25,000 to 30,000 rupees per month starting salary, and level 3 training is something like I would say, I think we are the first training program in the whole world. I do not know if even Harvard or Cambridge has got any training program where they put people into this stage of, let's say, a probationary period kind of training. Probationary period kind of training. Okay, please do not quote me wrong later on. Okay, so where someone is working, we can say mock session. Mock sessions, right?
Yes.
So a person is supposed to work along with a live medical scribe, just that his documentation doesn't go out anywhere. So he has
It's
to
more
make.
like on-the-job training.
It's more like on-the-job training. The difference with on-the-job training and this is, on-the-job training is actually, not actually, generally, when you are doing some kind of a job for the firm and the company is getting some kind of returns from your work. So, but here is not like it. It's just we call it shadowing. Okay, where you shadow. You know what's a shadow, right?
Yes.
Yeah. So shadowing is another way of saying about level 3 training. So once they complete these 3 levels of training, and always remember this, level 2 and level 3 training doesn't happen in any classroom or institute. It happens in the facility of a company which wants them to be their employees. So 6 months of training in a company which wants them to be their employees. So, and it's very easy to understand that you don't need a specific interview or selection process for them anymore once they complete the training program, because in the 6 months of period of training in the company, probably the company would even know, even if the student has got a girlfriend, the company may not know about that also. They know everything about the student. So that is why we say 100% placement guarantee. And I have heard about many more education programs talk about 100% placement guarantee. And there is a question that I generally ask, and I'm not talking about today, I'm talking about since 2006. This is 2020. 2006, I used to think, how can someone say 100% placement guarantee? Because when you say guarantee, you have to define that terminology, guarantee. Let's say when I say 100% placement guarantee for CPMS, there are some questions what a student or parent should ask. Let's say, what would be the average starting salary at least? Not exactly the same, but at least average starting salary. We have an answer. We say minimum starting salary would be up to 38,000 rupees per month. The next question they should ask is, what is the work location? What if I say the work location is Somalia? It doesn't make sense. So they don't define it. Most programs do not define it, but we do define. We say, as soon as we say Bangalore, because even if tomorrow we get 10,000 people who complete this program, we'll be so happy, because the vacancies are abundant. It's only building. It's becoming more and more and more. As I told earlier about one nation, one health card. I do not know exactly how many people we may require. Maybe 1 lakh. We do not know. When we are talking only about, let's say, medical scribing specialists for US doctors, I used to talk about getting 10,000 per annum or something like that. Today, if someone asks me like how many medical scribe would you require in a month, I have no clue. The population of India. No, as I already said, we are the number 1 in the world when it comes to giving service in this industry. The answers are like, what is CPMS? In short, CPMS is a program which really make you employable in the industry of medical scribing. This is the shortest way I can say about CPMS. And how do we do it? Because we train students not just based on classroom training, but we give them industry internship. We used to give them hefty stipends like 50,000 rupees per month. Thanks to Corona, now we cannot do that for some time. I mean, it is temporarily suspended, is how I would say. It's not that it is stopped forever, temporarily suspended, but we still continue assuring them jobs, not because we are doing them any favor or something. It's just because the industry needs lakhs of scribes, not thousands, not 10,000s. Lakhs of scribes are required in this industry. So this is how I can talk briefly about CPMS.
So Joshua, how will you connect One Nation, One Health Card and CPMS?
Okay, One Nation, One Health Card. So it speaks about a scenario where India has got health records of everyone. You can call it medical records or health record. Definitely it's no more written on papers, so we can call it as electronic health record or electronic medical records. So there should be someone who can do this process. You cannot actually, it's really unfair of asking doctors to do the clerical works, or let's say to prepare medical records or health records. There should be someone who does it. It has to be done by medical scribes. And CPMS, which is nothing but Certificate Program in Medical Scribing. So we are training people who can do this. So there are different way of saying it. Let's say health information management, or electronic health record technician, electronic health record manager, medical record summarizer, medical note reviewer. So there are different types of jobs with different types of salaries and technical specialties required. You cannot ask, let's say if you go to an automobile industry, there will be someone who is just into cleaning the tire, or someone who is into designing the whole automobile. There's no one who can design the whole automobile. It can be someone who is specialized into designing the engine. So, but still, they are all part of this automobile industry. CPMS is the only program which actually makes someone employable into almost any form of medical scribing job. So without a medical scribe, or without someone who can prepare this medical records, One Nation, One Health Card is not possible at all. It is not at all possible. We do have programs like Certified Machine Learning Specialist. Again, we do it, but there is a limit. I mean, we might have to wait for another maybe 10-20 years for that to make some kind of an impact on this industry. I mean, that is too far-fetched. Okay, that's too far-fetched. So there is no One Nation, One Health Card without proper medical documentation, and there is no medical documentation without people who know how to do medical documentation. That's what we are into. So this is the brief way I can tell about this.
So what you are saying is your company is pioneer in training people to do medical electronic form of documentation, which can
No,
be
I
used
would
medically.
actually I wouldn't say so, because see, the pioneers, as I said, started from the BCs. When it comes to electronic, yeah, definitely. See, mail later on became email or electronic email. So when it comes to even electronic form of medical documentation, definitely we are not the pioneers, but we are the best from 2015, definitely, probably from 2014. But if you say more precisely, see, when it comes to the highest form, or the technology that uses the latest form of medical documentation, as we said, medical scribing specialist, we are the pioneers. And we are not only there, actually we are already implementing artificial intelligence and machine learning, deep learning, data science and everything into this industry, and definitely we are the pioneers when it comes to this way. Okay, no, because we are, the way you asked whether we are the pioneers in electronic health recording, no, we are not. I mean, then it should have happened maybe probably, let's say 2000, probably 2017 or 18, India celebrated 25th anniversary of medical transcription, which is a very old, crude form of medical documentation. I mean, so we are far ahead. Okay, I mean, so yes, as of now, yeah, I think yes, we are the best. So Nakul, actually, what you need to understand clearly is, when it comes to any new form of job, let's say there was never a job called plumbing or electrician work, and imagine you invented, let's say, how do you say that? Okay, let be it software programming or C programming, let's say C programming or Unix or anything. Okay, first the program was created by someone, and then if that program has to be implemented perfectly and it has to be utilized by the world, definitely you need to have a training program where you train people to utilize this technology and do the job, be it anything, be it dentistry or be it anything. You think there should be a training program. So in that way, we are definitely the pioneers. I am very confident, because we have made a training program which encompasses a lot of training skills, not just about being a medical scribe specialist alone. We have made it in 3 levels, as I already told you before. So we are the best, not just in making someone a medical scribe. I would say we are the best in making someone employable. There are a lot of training programs that some are called graduation programs, post-graduation programs, doctoral programs, postdoctoral programs. Then there are many more certificate programs where the company themselves are not willing to take them. I do not want to name any of those training programs. Let's say certificate programs alone. Because certificate programs are more job oriented. I hope you know that leading companies are already not much more interested in graduates. They're looking at people who are capable of doing the job. Let me ask you one thing very clearly. Imagine you want a servant at your home, and you want him to do 2 things. 1, keep the home clean, and 2, clean your laundry. Just not clean, but iron and keep. That's what you want from him. You are not looking whether he's got a graduation from, let's say, some Switzerland college or something. You are looking for someone who has got a skill. So this is reality in this current scenario. When companies are, be it any industry, okay, they are wasting a lot of resources into training people to do these jobs. Let's not forget the fact that India's population, let's say around 65% of India's population is of the age group of 35 and below, which means we are supposed to be the most productive nation in the world, unlike Israel or Germany, or Italy, very well. They have got aging populations. So we have so much potential thanks to the age group that we have today. And CPMS advantage. Exactly, yeah. So CPMS is an answer. I would say CPMS can be a guideline for many more companies. Forget about new generation jobs. I wish other companies or maybe universities understand this fact and come up with training programs which make people employable. So definitely when it comes to One Nation One Health Card, we are the answer. I wish there were many more, because we alone cannot suffice. I wish there were 100 more companies like us who would train thousands more, because there's a limit to which we can train. Maybe we can train 1,000 people or 2,000 people or maybe 10,000 people in a year. It is not sufficient. We need more. I wish there were many more companies who would come up with similar training programs which are really job oriented, not just namesake, really job oriented, really giving industrial internship while training and making them really employable. I hope you must have noticed that Aiden left.
Yeah.
You shouldn't have asked such serious questions. I mean, this was not supposed to be a serious discussion at all. Anyways, when Aiden comes back, I think you should apologize to him. That's all.
We'll make it more interesting in our next video. Thank you.